You can't control the family you were born into. And if you have a family history, a strong family history of heart disease or heart attacks, well, your risk is very likely higher than someone who doesn't have that same family history. Heart attacks are scary and they can be downright deadly. But the good news is that there are things we can do to lower our risk for having a heart attack. Guys, we're going to talk about those today. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. The first risk factor that you can control or affect is smoking. One of the best things you could ever do is to never have smoked, or if you do smoke, quit. We know that smoking increases your risk for lung cancer, but it also increases your risk for things like heart attacks and so many other things. So talk to your doctor if you need help quitting. But also things like cholesterol and your blood pressure. Those are risk factors for heart attacks that we can often control, either through diet and lifestyle, which is what we want everyone to do, but also some may need medications as well. Make sure you're keeping your numbers in a healthy range. The next thing is physical inactivity. That's right. Not being physically active is a risk factor for heart attacks. I want you to get out there and get moving. Start walking, start pedaling, start cycling, start whatever. But movement and activity is going to be important for you. The last two are keeping a healthy weight. Obesity is a risk factor for heart attacks. You want to keep a healthy weight. Of course, that goes along with making sure you're eating a healthy diet and exercising and things like that. Notice a lot of these things go together, right? And then finally, diabetes. Diabetes is a risk factor for heart attacks. Diabetes is a risk factor actually for a lot of things, heart disease and many other things. You want to make sure your numbers are in a healthy range. You need to be seeing your doctor regularly, checking your sugars, following your doctor's advice, taking your medications, watching your diet, exercising, etc. Guys, these are the risk factors that we can modify, that we can change, that will help lower our risk for heart attacks. You know, that's the good thing. If there is any good thing about heart attacks, which there's not many good things, but one good thing is that there are modifiable risk factors, the ones I just mentioned. Now, unfortunately, there are some risk factors you cannot really do much about, right? They are risk factors for heart attacks, and you just can't do anything about them. Your age, for example. You have no control over your age. But the older we get, the higher the risk for heart attacks. Also, men have a higher risk for heart attacks than women. You can't control your gender, can you? But you should know that. Men also tend to have heart attacks earlier or younger, at a younger age. Also, family history. You can't control the family you were born into. And if you have a family history, a strong family history of heart disease or heart attacks, well, your risk is very likely higher than someone who doesn't have that same family history, and that's not to your fault. Also, certain races have a higher risk for heart attacks. African Americans, Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans. This is according to the American Heart Association, guys. These racial groups tend to have a higher risk for heart attacks as well. And then finally, the last group of potential risk factors are risk factors which, we're still learning a lot about, but we suspect are risk factors for heart attacks. Things like, not drinking alcohol in moderation. What do I mean by that? Well, drinking too much alcohol, being under a lot of stress. Stress matters, by the way. Stress can affect not only our minds, but our bodies too. And then, of course, a poor diet. Guys, I hope these are helpful. Remember, when it comes to heart disease and your risk for heart attacks, there are a lot of things we can do to lower that risk. Make sure you're working with your doctor, your healthcare provider, to make sure that you have the best healthcare and the best health possible. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you who have not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. Thank you so much. Consider joining my subscription group, Dr. Jen Superstars, for exclusive content. And for those of you on YouTube, hello, and please consider subscribing to my channel and clicking the little bell for updates. Bye.